This conference will now be recorded.
Good evening, everyone. My name is Shaquille Salim. I'm one of the interventional spine and sports medicine doctors at Reconstructive Orthopedic. It's an interesting world that we are living in. Within a matter of 45 months, I can't recognize the world that I've been in for the past 44 years. COVID-19 has changed everything. It has changed the way businesses are done. It's already changing education, and now it has changed medical practice. I'm going to be speaking about low back pain and neck pain, and I thought it would be a wonderful experience to share with you how it's impacting the normal treatment of neck pain and low back pain in the world of COVID-19. So for the next 35 to 40 minutes, this is going to be our agenda. We'll start with some information about COVID-19. Then we'll talk about the main aspect of this presentation, which is neck and low back pain. We'll discuss treatment options, and then we'll piggyback to COVID-19 and see how that is impacting the conservative treatments for neck, which is cervical, and low back pain, which is lumbar pain. So let's start with some facts about COVID-19, okay? One of the big misperceptions is that young people don't get it. This is not true. The disease can affect absolutely anyone and everyone. Age has nothing to do with it. Race has nothing to do with it. Everyone is at risk. Anyone who is exposed is at risk. The immediate risk of becoming seriously ill from the virus is low. That's very important. That's what proposes the misperception that young people don't get ill, because sometimes a person could be exposed, a person could be infected, but they actually heal. They don't have to go to the hospital. They don't have the significant respiratory symptoms. The risk is increased in the elderly and the immunocompromised. Immunocompromised means that any individual with the underlying condition where your immune system is not as healthy as a normal human being. So if an individual who is elderly gets infected with the COVID-19, or an individual who is immunocompromised, someone such as having some sort of metastatic disease, HIV, even cardiovascular, because your body's not as strong, and diabetes, and any immunological conditions, such as rheumatological conditions, could be considered immunocompromised. We hear things on the news that a person is being self-quarantined. What that means is if an individual was exposed to COVID-19, I had a patient whose daughter tested positive, and she had an appointment and she called to cancel the appointment, and her response was that I'm quarantining myself. She went spoke to her primary care doctor, who advised her to quarantine herself for 14 days. If an individual quarantines themselves and does not show any signs of infection, they really do not pose a risk to the normal population. After the self-quarantine period, they can come out. By no means are they an additional risk for the masses, the community, if they were exposed to someone who had it, because they have been quarantined and they did not show any signs and symptoms. So that means that they were not infected. One of the most strangest things about COVID-19 is that an individual could be infected, yet have absolutely no symptoms. And that's the fear. And that's very common amongst young people. And that is one thing that really is causing a problem in the state of Florida currently. Because you have all these young folks who don't have any symptoms. They think they are healthy, which they are. They think that they have absolutely nothing to be concerned about, but we don't know if they are infected, being that they are carriers but have no symptoms. Just because an individual does not have any symptoms does not mean that they can't go back home and give it to their parents, give it to their grandparents, or give it to their children. Anyone can be exposed to it, and that is quite frightening. Last thing about the virus. Everyone thinks that, there's some sort of a cure, there's some sort of medications, and there is none. There is no vaccine available. Typically, there isn't really much of medications that we can give an individual has a viral infection. We can support the human body by giving medications, but typically the immune system, our own immune system, the army in our body that fights infection, will kill the virus and make us get better. And lastly, one thing that has been proven over and over again, wearing a mask and social distancing will protect you and others around you. A lot of people have a misperception why we should wear a mask. The reason why I wear a mask is not to protect me. A lot of people have that misperception. The individual wearing the mask is protecting the people around them. So as a result, when I speak, when I sneeze, when I cough, there are respiratory droplets that can be diffusely spread in the area that I'm at. And if there are people around me, it can affect them. So by wearing a mask and keeping a 6 feet social distancing, you are trying to minimize the rate of infection. Always remember one thing. If there's one thing that you can take away from COVID-19 information that I'm going to share with you is you cannot control the virus. You can control the transmission. You can't eliminate the transmission, but you can try to minimize it and control the transmission from one human being to another, but you cannot control the virus.
Excuse me, Dr. Salim, I'm sorry to butt in. I just wanted to mention again, if you're calling in, if you can just please mute your microphones because we are getting some extra background noise. Thank you. Sorry.
Okay, so signs and symptoms of COVID-19 infection. This is a very primitive slide. I wrote down some symptoms such as fever, cough, shortness of breath. These are the most common symptoms and the most dangerous ones because I'm sure everyone has read stuff online or heard in the news as well as reading in the newspapers that people who get infected, the folks who die from the virus die from respiratory failure. They have fever, they have cough, they have symptoms of pneumonia, and they have difficulty breathing, and thus they develop respiratory failure. But it is not confined to respiratory symptoms, and a lot of people have a misperception of that. Okay, I have a lot of friends, I have family members who are different types of doctors, and you can have dermatological symptoms. There are lesions in the skin that a person can get. There are cardiac symptoms. There are neurological symptoms. My sister is an ophthalmologist. There are visual and ocular symptoms that they are discovering. This COVID-19, the coronavirus, is a new entity, and we're going to learn as we proceed in life. But these are the most common symptoms that can be very easily recognized. And this is when a person needs to become vigilant. So if you have a fever, if you have an unrelenting cough, and you're having difficulty breathing to the point that you have to go to the emergency room, they will probably quarantine you and do the appropriate testing to ensure that it's not COVID-19. So some safety precautions to avoid COVID-19. As I mentioned to you a few minutes ago, please remember you cannot control the virus. The virus is an airborne virus, it's everywhere. What you can control is the transmission of the virus. And because it is an airborne virus, right, it can get in your hands by you touching your face. So washing your hands repeatedly with soap and water is very important, What studies have shown that if you wash your hands with soap and water for at least 20 seconds, not just rinsing them, to actually wash it appropriately, it can actually help you significantly. Avoid touching your eyes and mouth. You have mucosa, you have, open areas where the virus could actually go in. Stay home if you're sick. Just having a cough, having a fever, does not mean that you have the COVID-19, but if you do have it, you could actually spread it. So if you're not feeling well, please stay home, talk to your primary care doctor, and let he or she dictate as to what you should do. And quarantine yourself. If an individual that I being a physician, I see a lot of patients, and I tell them patients all the time that if you ever become, if you are found to be in contact with an infected individual, please tell me, because I take ownership of that, because I see so many patients. So if a patient that I see is exposed, thus meaning that I am exposed, which equates to all the patients that I see could be exposed. So we have to keep an eye on that. Wear masks and practice social distancing, as I mentioned before. Okay, this is the safety precautions for COVID-19. So now we're going to talk about my passion, my specialty, spine pain. So I'm going to use the word spine rather than neck and low back pain, because if you remember your high school biology, the spine starts from the base of the neck and goes all the way down to your tailbone. The spine is divided in three sections. You have the cervical spine, which is the neck. You have the thoracic spine, which is the mid back. And then you have the lumbar spine, which is the low back. The symptoms are very similar. The treatments are very similar. The only difference is the location of your symptoms and where the symptoms go. Because the nerves from our neck go to our upper extremities, the nerves from our mid back, meaning the thoracic spine, go to our ribs, and the nerves from our low back go to our legs. A person could have a problem in their low back, but that's not going to cause any symptoms going to your upper extremities. If an individual has low back pain and leg pain, but they're also having some numbing sensation shooting down their arm, most likely they have two distinct problems. They have a problem in their cervical spine and they have a problem in their lumbar spine. So with that said, some of the signs and symptoms associated with neck and low back pain, you can get axial pain. Axial means just localized in the neck or localized in the low back. The pain does not really radiate anywhere. Okay, you can have pain on movement of the neck. A lot of times when people have neck issues, they complain that I hear a crackling sound and I have difficulty driving because I can't look at my blind spot because it hurts to look. You can have pain in your low back, but which is only localized in the low back. And the pain is worsened on walking, bending, extending, twisting. Movement causes pain. Even though everyone is aware of neck and low back pain, but believe it or not, sometimes a person may not have to have neck and low back pain, but they can have symptoms that radiate to the upper or lower extremities. As I mentioned a few minutes ago, the nerves in our spine, if once again going back to your high school biology, we have the spinal cord, and then we have nerves that exit out of the spinal cord, which are called spinal nerves or spinal roots. These nerves from your neck, they go to your arm. So if there is a compromise of a nerve in your neck, you can get any kind of symptoms that radiate to the arm. I am so used to saying the word pain, but at times it doesn't need to be pain. A person could have numbness. A person could have tingling sensation. An individual could have a burning sensation. A person could have pain or a combination of all these symptoms, okay? Furthermore, the nerves in our neck that come to our arms, in addition to sensation, right, also have motor activities, meaning movement. So if a nerve is compromised, or God forbid, if you have a compromise with the spinal cord, you can have difficulty with fine motor skills. So difficulty writing, difficulty with lifting things from your fingers, difficulty opening a milk container, because your fine motor skills, these skills which are very detailed movements, could be compromised. And if the problem is quite significant, where there is a problem with your spinal cord due to a problem in your spine, you can have loss of control of your urine and bladder and difficulty walking. Okay, you can have weakness, you'd have a problem with the transmission of the signal from your brain, from your spine to your legs, and your legs don't cooperate. And lastly, if there is damage to the nerves exit your spine and they go to the muscles in your upper and lower extremities. If there is some sort of damage, you could start seeing a decrease in the muscle bulk, meaning that they get atrophied, they shrink. So a person could have symptoms and they realize that the muscles in their arms or their legs is shrinking. And sometimes you could have unilateral. You can have a right leg which looks much smaller, like the calf muscle is significantly smaller compared to the left leg. And those are things that we have to look for as physicians. And now that you are aware of this, if an individual in your family, your loved ones has symptoms, these are just little things that you want to keep in mind. And if you have any of these symptoms, you probably want to have a discussion with your primary care doctor or a spine interventionalist such as I. Okay, so let's talk about some of the common causes of neck and low back pain. The most common cause is myofascial strain. Okay, that's a nice way of saying a pulled muscle. A pulled muscle sounds so remedial, because you could throw a baseball, pull a muscle, not a big deal. But when it comes to the spine, it's quite complicated and it's quite interesting because, and I have a slide, there are so many muscles in your neck, thoracic, and lumbar spine, and they work in such a complex biomechanical manner that if you pull a muscle in your low back, because of the compensation that your body will do to try to avoid feeling that pain, I've actually seen patients who have back issues and they start developing headaches. I have seen patients who have neck issues and they're having pain in their buttock just because of the compensation and the changes in their gait and the changes in their movement. So myofascial strain, also known as a pulled muscle, could be quite debilitating and quite painful, even though the word muscle strain doesn't sound very complicated. The most important thing that we always have to be concerned about is a nerve problem. A person can have an irritated nerve, the spinal roots and the spinal nerves that we spoke about. There are a number of reasons why one of these nerves could be compromised, and we're going to talk about that a little bit. And lastly, you could have degenerative changes, such as arthritic changes. You could have degenerative disc disease and bone disease, and that can also impact your nerves and cause axial, neck, and low back pain. So this was a simple slide for me, but as you can see, there are so many muscles that control your spine. So imagine all these muscles over here, but if you pull your trapezius muscle, right, which is the muscle that is around your shoulder blades, the human body compensates, and the next thing you know, you could have headaches in the base of your head. You can have shoulder pain. You can have pain going down your mid-back. You can even have pain in your upper lumbar region, and it's just a strain of a muscle that is mostly localized around your shoulder blade. So pulled muscle could be quite debilitating and quite complicated, and that's not something to be taken lightly. The next thing that I'm going to speak about is nerve root irritation. The reason why I said nerve root irritation, because it could be a plethora of things that can cause a nerve to be compromised, okay? A nerve could be inflamed, and it will cause the same types of symptoms, or a nerve could be compressed. There are various reasons, and we're going to touch upon that can cause a compression of the nerve, and that will cause pain radiating to your extremities. So if you have an inflamed nerve or a compressed nerve in your neck, you will have pain that radiates to your upper extremities. And if you have a inflamed nerve or pinched nerve in your lumbar spine, which is the low back, you will have pain that radiates down to your leg. And very rarely a person can have a compromised nerve in the thoracic spine, and you will have pain that radiates to your chest. When I was an intern many years ago, I did a couple of rotations in my training in the emergency room. And there is always at least 1 or 2 patients a day that thinks they're having a heart attack because they're having pain shooting down their chest. And after a workup, they're told that it's not cardiac in nature. Ironically, it's your spine that is causing you to have these symptoms. So once again, that's nerve root irritation. So the damage occurs due to wear and tear. Why it occurs during wear and tear, we can't control it. The human body degenerates over time. All of us are going to get older as we proceed in life. The joints, the structures in our body are going to degenerate. Okay, the example that I always like to give my patients is that if you have a brand new car and you drive it around, after a certain period of time, the tires are going to get worn out. The same thing happens to all the joints in our body. And the spine, although it's complicated, it has joints, it has discs or intervertebral discs, and it has your spinal cord and your spinal nerves, but they all could get compromised. The word that many people are familiar with is sciatica. Okay, it is, people come to me, they're like, I have sciatica. What they mean is they're having low back pain going down the leg. The medical terminology is lumbar radiculitis or lumbar radiculopathy, but sciatica is a very commonly used phrase, and it's a well accepted phrase. But what that means is that you have a compromised nerve in your lumbar spine. A person can have the same symptoms, but in the neck, because a nerve could be compromised in your cervical spine, but rather than an individual feeling pain radiating to their leg, they will feel pain radiating down their arm. A pain could be worsened on movement. Okay, when you have a pinched nerve, a lot of people are like, it hurts, but if I turn a certain way, the pain shoots down my leg. There are multiple reasons why you can have that. If you have significant arthritis, the joint is compromised, and the location of the nerve with the movement is irritating the nerve. If you have a degenerative disc, which is herniated, a certain movement causes the herniated disc to push against the nerve, which can cause significant discomfort and pain. A person can have, as I mentioned not too long ago, I'm so used to saying the word pain, but it doesn't have to be pain. It could be numbing sensation, tingling sensation, radiating down the legs, radiating down to the arms, okay? Typically speaking, it's usually unilateral, but it does not have to be. A person can have low back pain that shoots down both legs, neck pain that shoots down both legs. If the symptoms are because of a disc herniation, it really depends on the location of the disc herniation and where exactly it's pressing against the nerve. If it is a central disc herniation, it can certainly compromise your left and right side. And once again, as mentioned earlier, in severe cases, if you have a compromised nerve for multiple reasons, if you have a compromised spinal cord, you could actually have loss of control of your bowel and bladder. And that is quite concerning, and that needs to be addressed immediately. This is a nice picture and a schematic as well as an MRI of a disc herniation. So a disc is a shock absorber of the human body, okay? Every single time we cough, we sneeze, we lift something, each step that we take, there is a stress that is reproduced, and the discs in our body absorb that stress. When a disc becomes degenerative, meaning that it is not healthy, okay, it starts giving us problems. And the best way to describe a disc is the jelly or cream donut analogy. An intervertebral disc is similar to a jelly or cream donut. It has a gelatinous material in the center, which absorbs shocks. When you cough, sneeze, if you lift something, it absorbs those pressures. However, if any one of you has had jelly or cream donuts, you will know that if you squeeze the donut too hard, the jelly comes out. Well, taking the same analogy, if the jelly comes out, that is a disc herniation. And as you can see, the jelly is coming out, and this is a spinal nerve and is being compromised. It is being compressed. And depending on which nerve is being compressed, you will have pain in the distribution of that particular nerve. So when an individual comes to me, they don't really need to have an X-ray or an MRI. Just from their history, which is very critical, from their history, I can have a very good idea as to which nerve is being compromised and the reasons why they are having such symptoms. The other reason why you can have these issues with your spine is bony encroachment. What that means is that if a person has any condition that changes the structure of the bone, such as significant arthritis, we have holes in our spine known as foramen, and the nerve exits, just like a thread going through a needle. And if an individual has significant arthritis, that hole starts to close up and it can actually compress on the nerve. So that's bone encroachment. And this is a simple schematic that can actually illustrate that. As you can see, this is a foramen, meaning that there's a hole that the nerve is exiting. And you can see this is foraminal stenosis and degenerative disc. What occurred is that because of the degenerative changes, the hole has tightened up and the sealing of the hole or the integrity of the hole is compressed because of the disc being unhealthy, being degenerative, so it dries up. So it's like a double whammy and it can compress on your spinal nerve, excuse me. This is called spinal stenosis, okay? We have a canal in our spine where all the nerves are floating. A person can have a disc herniation, significant degenerative changes, and that little tube where all the nerves are floating could be compressed. And that compression is called spinal stenosis. The typical symptoms a person gets when they have spinal stenosis is they typically do not have any significant pain while they're sitting down. However, as soon as they stand up or they walk for a short distance of time, the pain becomes significant. The pain could be in their low back, or it could be radiating down to their legs, but it becomes significant to the point that they are forced to sit down. And as soon as they sit down, in a short period of time, the pain resolves. Yet when they start walking again, the exact symptoms recur. That is called spinal stenosis. So with having the knowledge that we just shared, what are some of the treatments of spine pain, neck and low back pain? The treatments are really divided into three aspects. You have conservative management, you have significant aggressive treatment, and you have things in the middle. The conservative management is medications and physical therapy. We can give medications to decrease inflammation. We can give medications to relax the muscles because a person can complain of muscle spasms and myofascial pain. Physical therapy is critical. Core strengthening the muscles that control your spine can give significant relief. It can also slow down the degeneration, okay? By strengthening your muscles, you decrease the stress on a joint because the muscles are strong enough to absorb some of the additional stress. Typically speaking, people who are very active and have a good core typically don't have as much symptoms compared to someone who has a weak core. If the conservative management does not help, if the conservative management is futile, the next treatment option becomes epidural injections. Now, the important thing about the epidural injections is it does not fix the problem. A lot of people always ask, like, will my disc herniation will be pushed back in because of the epidural injection? And the answer to that question is no. It does not fix the problem. What the epidural injection does is by putting medication at the location of the nerves, which is compromised, you will decrease the inflammation, thus allowing the nerve to heal itself, and your symptoms should improve, okay? Unfortunately, because we didn't fix the problem, after a certain period of time, the symptoms are going to come back. The time could be, I've seen it all. I've seen people come to me like clockwork every 3 to 4 months. And I've also seen people who come to me once every couple of years. It's multifactorial. There are things that you can control and things you cannot, right? It depends on your body chemistry, how quickly you develop inflammation. It depends on your activities. It depends on your sedentary lifestyle versus an active lifestyle. People who are active, as I mentioned to you, typically do very well because they always have a good, healthy core and they're active. People who live a very sedentary lifestyle, they get an epidural injection, they feel better, but then they get recurrence of symptoms a bit sooner compared to someone who's more active, and various other reasons. And then if everything else fails, conservative treatment has not given adequate pain relief. We've tried multiple epidural steroid injections, has not given adequate pain relief. The symptoms are becoming quite significant. God forbid, if you develop weakness, difficulty walking, or the worst case, like if you lose control of your bowel and bladder, then obviously surgery is something that has to be on the table, and we have to have a discussion and refer the patient to a spine surgeon for the treatment. So now let's put all these things together, okay? The treatment options, I tried to simplify it, so I didn't really go into the details of the treatments, but in general, I try to simplify things for my patients as well. And I tell them there's really 3 treatments. You can do physical therapy, medications, epidural injections, or surgery. And surgery is really the last of the last. And depending on the symptoms and the images, we don't really talk about surgery immediately. So how COVID-19 has changed everything, okay? So let's talk about one thing. We spoke about physical therapy. We spoke about medications. I have a lot of patients who are very concerned about physical therapy. They ask me, like, they can't watch the news, they can't read a newspaper without everyone talking about social distancing. How can they possibly do physical therapy and still have a social distance? They're concerned about that. And that is a very valid concern, right? How can people be comfortable with physical therapy due to social distancing? Now, I've had conversations with many physical therapists, and they assure me that they take all the precautions, and they're healthcare providers themselves. They take all the precautions, but it's kind of hard to tell an individual that, you know what, they take all the precautions, but I cannot guarantee you because there's always a risk, okay? Let's talk about option number 2, epidural injections. The medication that is used for epidural injections is a steroid. A steroid is a wonderful medication. It decreases inflammation, which is fantastic. However, not many people realize this, but inflammation is a part of your immune system. And when a person takes oral steroids or gets injected with steroids, there is evidence that it suppresses your immune system. So prior to COVID-19, we really didn't talk about this because if an individual took steroids, if an individual had a cortisone shot, if an individual had an epidural injection, the risks are minimal, but worst case scenario, they will get the sniffles, okay? In today's world, God forbid, the sniffles could kill you. So epidural steroid injections become concerning. Now, by no means, and this is very important, by no means am I saying that if you get an epidural injection, you're going to get the coronavirus. That is absolutely not accurate, and by no means am I saying that. What I am saying is that you have to inform the patient that although the risks are minimal, there is an increased risk of a bacterial or viral infection. I'll give you an example of myself. When I was young and throughout my schooling, particularly in my elementary school and junior high school, I suffered from asthma, and I had the prednisone inhaler, and I used to take a vasodilator, and I always had the sniffles. I mean, it was like I had a cold for like a month or 2 months, and I never understood it. It was most likely the prednisone that I was taking because I had severe asthma, so I was taking it a lot, and it probably impacted it. So the thing is, prior to COVID-19, it wasn't that much of a concern because, as I mentioned to you, the risks are minimal, but the risks are there. And prior to COVID-19, we didn't even really care about the risk because, worst case scenario, you get the sniffles. But now, ethically, we have to share with our patients that although the risk is minimal, there is a risk of compromising your immune system. Minimal risk, but we have to inform the patient and get informed consent. And I already spoke about the oral steroids. We never got to the position that Europe was in, but in Europe, there were many countries that actually banned anti-inflammatory medications because as coronavirus was starting, they really didn't know what they were dealing with. So people stated that you cannot take, in Europe in particular, that you cannot take anti-inflammatory medication because they may impact your immune system as well. So the best thing that we can do for prevention of low back pain is you really want to have a healthy core. You want to have the core of your lumbar as well as the muscles of your neck. You want to have a good core. So doing appropriate home exercises to strengthen your core can certainly help you in the long run. It is proven over and over again that the best treatment for people who suffer from back pain long term is exercising and having a healthy core. It is better than surgery, and it's better than injection, and the outcomes of the injection and surgery can be significantly constructive if you incorporate a good core strengthening program. Okay? When a person has a degenerative disc or degenerative joints, you want to decrease the stress. And core strengthening will also decrease the stress because there's only two ways to really decrease stress, right? You either strengthen the muscles of the joint or you decrease the weight on that joint. So your lumbar spine, which is the weight bearing, right? If you have a healthy weight, you will feel a difference. Being overweight adds stress in your low back, which aggravates your symptoms. You really want to use proper lifting mechanics because not bending from the knees and lifting something heavy predisposes you for a lumbar strain, and that can cause muscle pain. Avoid smoking. Everyone knows about the horrors of smoking with lung cancer and all these respiratory pathologies. But believe it or not, studies have shown that smoking actually causes the spine to age faster. What that means is that the degenerative changes that we spoke about, right, occur more rapidly and more significantly, right? And having a good posture. You would want to have good flexible muscles because tight muscles actually cause posture problems, and having tight muscles can also predispose you to myofascial pain. That pretty much ends my presentation. I am open to any questions that anyone would have. The take-home message, I want to stress two things. The first thing is that we unfortunately cannot control the virus. It's here and it's here to stay unless there is a vaccine that is developed or they develop a way to minimize the transmission. There are things that we can do to ensure that we have a healthy spine. And the most easiest and best thing that we have is a good, healthy home exercise program. Epidural injections, people are afraid, and rightfully so, is a very valid option, okay? Although it increases the risks are relatively minimal, okay? I repeat the comment that I made not too long ago that just because you get an epidural injection by no means doesn't mean that you will contract the virus. All it means is that you have a higher risk. Similarly, if an individual walks around without a mask, he or she has a higher risk compared to someone who has a mask. Wearing the mask doesn't mean that you can't get the coronavirus, but it decreases the risk. And not wearing the mask doesn't mean that you will get it, but it increases the risk. In this presentation, if those three things could be the take-home messages, I would consider that I was successful. Any questions or concerns?
Thank you, Dr. Salim, again, for such an informative presentation. Like Dr. Salim mentioned, we'd like to open it up for questions. You can feel free to type something in the chat box, or if you feel more comfortable unmuting yourself, please feel free to ask your question. Let's just make sure we have one person speaking at a time. We'll give it a minute just in case somebody's typing. All right, well, if there's no questions for this evening, I'd like to thank everybody for joining us. Also, I'd like to thank Dr. Salim for a very informative presentation. And I wish everybody a good evening and happy Father's Day.
Thank you.
Thank you
for joining us, everyone.
Thank you. Good night.